Okay, welcome aboard, everybody. Thank you very much. This is Dr. Sean Orr, and I want to tell you thank you for joining me today for my webinar, Creating a Better Life for Physicians. And we're going to create a better life for physicians by helping them to prepare their trusted advisors. And I want to thank everybody for showing up. We have some folks who are just entering the chat room right now, so we'll give everybody a minute to get on board here. And I just want to point out a couple of features here. You should see a chat box on the bottom of your screen where you can input any questions or chat with other members of the audience. We're going to go for about 40 to 45 minutes in this talk, and then we're going to have some questions, a question and answer session when we're done here. And I'll be delighted to take your questions at that time, and we'll look forward to hearing your feedback. So before we get into it, in your email that you received after confirming your registration, you should have received a couple of links. And one of those is to this complimentary $100 value book that we've put together called The Physician's Guide to Disruption. And this is a book that's just jam-packed full of information about the challenges that physicians are facing right now today. And we put it together and we've given it to you free here exclusively for this conference. And so I would encourage you to, if you haven't downloaded it already, it is a digital book. You're welcome to download it at your leisure. You don't necessarily need this right here to go through this webinar talk, though. What is very helpful for you to have in front of you is a webinar workbook. And again, I've given you that the link to access this. You can either download it or you can follow it along. You can print it out. The whole goal here is to give you maximum value from this webinar. I want you to leave here with a brand new understanding of the challenges that we're all facing in healthcare today, and especially the challenges that physicians are facing, because it really directly impacts their patients. So you all will benefit by following along and taking notes. And this webinar workbook will give you some guidance through that process and help to set you up to be able to do questions and answers at the end as well. All right, well, let's just go ahead and jump on into it. It looks like we've gotten a number of people who have signed on, and I really appreciate you all being here. Joe, thanks for being here. Maureen. And I think let's just deal with the elephant in the room, and that is that today's physicians are in distress. They've lost their autonomy, they've lost the power and control over their careers and lives, and they're burning out in droves. The health of our communities is being threatened, and the purpose of this webinar is to tell you why. I'm going to share critical insights with you about this looming problem. And the purpose of this is so that we can forge a path to make things better for physicians and ultimately for their patients and our communities at large. If you're a practicing physician, you know a thing or two of what I'm about to reveal. But if you're a trusted advisor, like an attorney or an accountant or a financial advisor, or frankly, any one of these other numbers of professionals who may interact with or advise physicians on a regular basis, then you probably struggle to truly understand your physician client's biggest challenges. So this program was created to address this problem of disconnect for you. You see, doctors are very familiar with the notion of silos in medicine. It can be very difficult to coordinate the care of a patient. It's not uncommon for patients to have less than optimal outcomes as a result of that fragmentation. Likewise, when it comes to taking care of the needs of a physician, trusted advisors frequently operate in their own silos. It can be just as difficult for any one trusted advisor to coordinate all the needs of one physician client. And this creates a problem for physicians who naturally expect their advisors, of course, to know everything. Well, at the Restored Physician, we're taking this upon ourselves. We're building a network and the tools to help address this problem. Because the truth is that even most physicians don't know all of the landmines waiting to trip them up. And most of their advisors are even less clued in. So if this sounds like you, whether you're a physician or a trusted advisor, then the workshop lab and network we're creating are definitely for you. During this webinar, at times when there's an issue or a subject that pops up that we're going to be covering in an upcoming workshop, you're going to see a little thought bubble pop up. And I just want you to be aware that this represents that a much more in-depth content availability to you should you choose to join our workshop lab, which is coming up starting next week. I'm also going to give you another little gift of insight. See, we're going to blaze through a lot of information, and I've packed a lot into this short talk. So if you do stick around, please do. At the end, you're going to get access to a tool that we've designed just for you that will help you quite a bit, I think. So let's get into what you're going to learn in this webinar today. First, you're going to go through the top 4 challenges facing physicians today, and that's going to be the main focus of this webinar, and that is what we're going to be focusing in on our workshop as well. Challenge number 1 is physician disruption. You've already heard me mention it. We're going to go into depth in that here. Challenge number 2 is physician burnout. Challenge number 3 is the financial threats and losses that physicians are exposed to. And challenge number 4, surprisingly, is the difficulty of getting qualified help. So you're here now because you're a physician or you provide advisory services to physicians, and this talk should help make it clear why it's such a critically challenging time to be a physician. You'll also discover why there's never been a more important time to choose the right trusted advisor. Ultimately, I think you're here because deep down you know that there's a better way for physicians to live their lives, though. Now, this webinar is not for somebody who isn't willing to invest in the insights that I'm going to share. And it's not meant for a physician or a trusted advisor who is unwilling to change and grow. So if you're set and you already have it figured out, good for you. Count yourself among the lucky few. This talk is not for you. But if you're like most of us, if you're a physician in distress or if you advise those who are, then this talk was made just for you. And I know what I'm speaking of. I'm speaking from personal experience. I've been through physician disruption myself. I know firsthand the challenges that physicians face today. I'm a neurologist and I'm the co-creator of the Restored Physician Network. And I've always been an ambitious, accomplished professional. In training, I was chief resident and I won numerous awards. I was very fortunate to land a cutting-edge, groundbreaking fellowship where I helped my mentor to carve a pathway and forge new specialties in neurology that ultimately led to the creation of neuroendovascular therapy, neurocritical care, and advanced stroke therapeutics. I eventually, when I was done with my fellowship training, became the chief of neurology of a large regional healthcare conglomerate in Jacksonville, Florida. And there I assumed the mantle of the Stroke Center medical director. I took care of professional athletes and I built a booming practice and had thousands of patients who just really loved me. I was an industry advisor to the pharmaceutical industry and to the biotech industry. I eventually became the vice president of a medical technology company. I've been an advisor to startup companies, to their boards, and I've been an advisor to a professional liability company. So I've gained quite a bit of experience across the board. I've had, and this is not something that I like to talk about. My attorneys and friends have called me a rock star doctor. I don't hang that mantle out there. But believe it or not, I discovered along the way that you can actually be a public figure. And this is one of those things we'll get into later on. But I thought I was a private citizen, and it turned out that all the marketing and the social media that I was doing and my aspirations to be a budding philanthropist made me a public figure, which is actually handled differently from a legal perspective. Well, on October 7th, 2011, I had my Icarus event. It all came crashing down. It seemed like everything changed just overnight. I was attacked from multiple directions in a war that has lasted more than 5 years. My colleagues and the hospital I worked for banished me. I had to take up temp work in distant hospitals. This was a huge fall from where I was before. I had worked years to climb to the pinnacle that I was on. And now to be traveling and being away from my family, it was just a really shameful, difficult time. My net income was cut by 75%. I was forced to resign from my advisory and my leadership positions. I was subjected to a key tam or whistleblower lawsuit by a clerical employee in the facility where I had worked for so many years, building up so much for them. This led to investigations, and I was eventually fined along with that institution by the Department of Justice in a very public and degrading way. I was attacked by multiple plaintiff attorneys in town who all bought into the notion that I had been a bad doctor. I was attacked by the mainstream media. The media showed up in the front door of my home and terrorized my wife and my children. They followed me around, they hounded me. I even ended up on the NBC Nightly News with Lester Holt. You can see, at least back then, I may have been balding, but my hair was still red. Well, you know, this last 5 years has washed that out of my hair. This was quite a traumatic episode for me, and never in my wildest imagination would I have imagined that I would have been portrayed in such a negative light. There are major consequences. I had a loss of my reputation, loss of my employment, loss of revenue, loss of my so-called friends, loss of my peace of mind, and loss of freedom. But out of all that loss, I gained some very valuable insights. And insight number one, which I want to emblazon on your minds here, is that I lost money because of my excessive confidence. I was incredibly confident that the high road would be the way to go, that my results would speak for themselves, and nothing could have been further from the truth. When somebody has an agenda, they will do whatever it takes in order to exert that agenda. And my overconfidence cost me big time. Insight number two is that there are people out there with unmatched power. This is one of my favorite sayings now. It comes from the ancient Latin, I have a catapult, give me all your money or I will fling an enormous rock at your head. Well, that's what happened to me. I had an enormous rock flung at my head and I had to give up pretty much everything that I had to people who wanted to claw it back from me. And I've named them already. Insight number three was that I was fragile. I had spent 14 years of higher education and almost that much time building up a practice. I thought I was invincible, but I was anything but. I was incredibly fragile. And insight number four, I had been disrupted. And this leads us to lesson number one. What is physician disruption? Well, let's take a step back for a moment and just look at the term of disruptive innovation. Disruptive innovation is the normal consequence of improving business efficiencies. It's a good thing. And we go into this in depth in our workshop lab. But as you can see in this quite confusing graph, it takes some time to break it down. The upshot of this is that innovative disruption is good for the marketplace. Successful innovative disruption requires three components. Number one, it requires enabling technology. Number two, it requires an innovative business model, something that's new. Number three, it requires a coherent value network, all the components to get together to actually exert the innovation. The upshot is that disruption is good for the consumer. But disruption is not necessarily good for the incumbent stakeholder. And disruption is not necessarily good for the incumbent physician who's not on board with getting innovative. The truth is that innovative disruption in healthcare is long overdue. And the evidence surrounds us. Between 1990 and 2007, even though there was an increase of employment in the healthcare market by 3%, productivity dropped almost 1%. And that is huge. We're one of the only industries where additional computing technology and such has actually driven decreases in productivity. It's very paroxysmal, and there are many reasons and factors that lead into this. It's no secret, and anybody who's paying any attention to politics for the last 6 months knows that even though GDP is gradually increasing, national healthcare expenditures have been increasing fivefold. So healthcare costs are going up, and they're nowhere in sight going down. And this is largely because innovative disruption has been held back. Incumbent stakeholders have prevented all of the initiatives that would bring new value into the marketplace. And so this problem continues to grow. And this is reflected in this graph, which again, we break down in our workshop, but just to kind of go through the elements here. I know it looks kind of confusing, bear with me here. What this basically shows is that since 1970, there's been basically a doubling in the number of physicians that have come into practice. So that's the red gradual increasing slope line on the bottom here. So that's reasonable. It seems like it probably should keep up with the population. What we're seeing in the yellow zone here is the number of administrators who have come into the healthcare marketplace simply to keep up with the regulations that have been passed, like the Healthcare Quality Improvement Act and the Patient Safety Quality Improvement Act. These are all major acts, and the ACA, which was passed in 2010, and who knows what the next initiative is going to be. Every time a new healthcare legislation gets passed, it adds to the number of administrators that need to enter the field just to deal with the burdens of administration. And if you look at the black bar, that is the percentage of growth in US healthcare spending per capita. And it really does seem to track the administrators, not the physicians. So I'd just like to kind of make this point that the growth of physicians and what we do for our patients really is not adding to the expense in healthcare. It is the administrative burdens, regulatory burdens, the number of administrators, and then all of the drama that comes from that environment. Now, this is having a major impact on our health. And if it weren't, and if we were having great results in health, then maybe it would be worth it, right? But I think the case has been made that the opposite is true. And very disturbingly, just last year in December, results were reported by the Centers for Disease Control that since 1993, for the first time since 1993, life expectancy in 2015 actually dropped. And this graph's a little hard to see, but except for cancer actually had an improvement in life expectancy, which may not be a surprise because the previous administration put so many resources into trying to cure cancer and conquer cancer, right? But in heart disease and lung disease and stroke and Alzheimer's disease, diabetes, influenza, kidney disease, etc., we're seeing actually a decrease in life expectancy. And I really do personally hope that this is just a bump in the road. I hope this is an aberration, and that next year we find out that in 2016 life expectancy continued to improve. But I'm concerned. I think a lot of us in the medical industry are very concerned that this represents the beginning of the failure of our health system to actually deliver. And it comes down to this: healthcare is vulnerable to disruption, and healthcare is fragile. So let's talk a little bit about this notion of fragility, because I've used the term several times here. We all know what fragility is, right? It's the quality of being easily broken or damaged. And it comes from the Latin fragilis, or from frangere, which is to break, okay? Pretty simple. We know fragile systems. They're surrounding us. A drinking glass, if you drop it, it breaks. It's fragile. Bones that are suffering from osteoporosis, they snap easily. Those are fragile. Some other systems are not quite as intuitive. The banking system, you may ask, why do I have that up there? But if you were alive in 2008 and you had any property, or frankly, were breathing and you had a pulse, you were aware that the banking system was under incredible duress. We almost had the next Great Depression, right? And we're all still feeling the effects of the banking system fragility that we're affected by. So systems can be fragile. And you have to think of fragility in terms of stressors, right? So stressors are tolerated in the system up to a certain breaking point. Larger stressors have even more impact, and big stressors are disruptors. That's where fracture takes place. That's where breakage takes place, is where big stresses are applied. Now, in healthcare, there are many manifestations of those disruptors as they affect physicians, and this is just a short list. Now, for the physicians on this call, please, if you haven't experienced any of these, raise a hand, let me know. Congratulations. Either you just got out of training or you're blessed. But frankly, there are so many ways that physicians can be disrupted. And this is just the beginning and we go through this in our workshop. We categorize these and start to break down how you deal with the interpersonal conflicts of workplace, of medical divorce. For those of you who are physicians online, did you know that privileged confidential conversations that you have with your spouse can be used against you in a medical divorce? Angry patients, the loss of the referral base, cynicism, governmental inquiries, the list goes on, and I'm not going to bore you with all the details. I think I would encourage you to join us in the workshop so we can dig through these, and especially for the trusted advisors, it's really incumbent upon you to understand this. These are the things that your doctor clients are going through. And the dirty little secret here is that they're often not going to tell you about these because they're embarrassing. They may not want you to know, if you're an accountant, that they're on the road to a peer review action. They may not even know themselves that they're on the road to a peer review action, which could be called a sham peer review, in a way to get the physician out of the hospital. So the more you know about this as a trusted advisor, the more marketable you're going to be to physicians. But at the end of the day, these are just surface effects. In medicine, when we're taking care of patients, we look at surface effects, and we ought to be looking for root causes to those effects. Why does somebody have neuropathy? Well, maybe because they have diabetes. Well, let's go work on the diabetes, right? So these manifestations of physician disruption are surface effects. And when we start to look for root causes, we find that there are four main sources of physician disruption. I'm going to break this down for you, but we'll go into this in much more detail in our workshop lab. But basically, we look at these in terms of system conflicts, and that may be at the level of the hospital or hospital administrators or payers. This may be in terms of legal actions, right? Threats to your practice, malpractice actions, large scale class actions that may be coming your way. We look at this, another source of physician disruption is technology, right? We like to think that computers enhance our productivity. In my world, I'm the biggest geek. I live my whole life out of my iPhone and out of my computers. You should see my office. It's covered with computers. The electronic medical record is one of the biggest productivity killers ever, and I refuse to use electronic medical records when caring for patients because it actually reduces my productivity. And I'm sad to say, but also feeling vindicated that the literature is catching up with me on this. We're seeing a major rethinking of electronic healthcare records these days. The fourth source of physician disruption is regulations, state and federal conflicts. One law says do this, another law says do this. An example of that would be that the Patient Safety Quality Improvement Act, which was passed by the federal government in 2005, is directly in contradiction by Amendment 7, which was passed by the Florida legislature at the same time. The two of them clash, and they clash all the time, and it causes all sorts of problems in the courts. But guess what? Physicians get caught right in the middle of that. And that leads me to lesson number 2, when doctors are caught in the middle. So burnout is a state of mental and or physical exhaustion that is caused by excessive and prolonged stress. Now, you don't have to be just a physician to burn out. Anybody can burn out. The idea here is that your brain does not get a break. It's the excessive and prolonged stress. And again, we go into great depth in this in our workshop lab. It's important to talk about this right now, and I'm so glad to see that the industry is finally waking up to this notion. It's a really big problem. 2 of the major causes of burnout are bureaucratic atmospheres, number 1, and number 2, overwork. And frankly, that describes what physicians live in these days. Really disturbingly is that half of all doctors are in some stage of burnout right now. So that's between 400 and 500,000 physicians in this country are in some stage of burnout. So let's talk about those stages of burnout. Stage 1 is stress arousal. Stage 2 is energy conservation, and stage 3 is exhaustion. So let's go into some detail here. Burnout stage 1, stress arousal. I'll let you read the list on the right-hand side here. But basically you get the idea that in stage 1 of burnout, it's not a good place to be. Physical symptoms start to emerge. Bruxism means grinding of the teeth. It happens sometimes at nighttime. If you're lucky enough to be getting sleep, doctors who are burning out in stage 1 start to get forgetful. They may complain of some heart rhythm problems, inability to concentrate, headaches are common. And the tricky part about this is that doctors generally don't recognize that they're on the path to burnout. So where most of the public, when they're starting to have these symptoms, they'll go see their doctor and get help. Doctors are notorious for not acting and getting help. So that's a problem because then it can lead to stage 2 or energy conservation. So this is where the doctor just reflexively kind of starts to circle his wagons. He or she will start to become late for work and procrastinate, maybe take 3-day weekends off. Sexual desire goes out the window. And so you get the idea that this is somebody who's now really starting to feel the effects of the loss of energy, and they're trying to prevent it. They may get cynical. The patient starts to become the enemy. The administrators are the enemy. They get resentful about their circumstances, and they start to use more substances to compensate for it. So I'll talk to you in another conversation about biohacking and brain augmentation and cognitive improvement, but most people don't do it well. And it comes down to using coffee in the morning to wake up and wine or alcohol, beer, liquor at nighttime to go to sleep. Not a healthy way of handling this. And by the time you get to the end of stage 2, apathy is set in. You really don't care. And that's where exhaustion comes in at burnout stage 3. And this is where really serious manifestations start to show up. A lot of it is somatic, bowel, stomach problems, but mental fatigue and physical fatigue really kick in. Now you can imagine that this is a problem for patients, right? So patients are expecting their doctor to show up fresh, thinking well, solving problems, doing the things they want to do, and loving them, right? Engaging in a good patient-physician relationship, caring for them. Well, if a doctor is in burnout stage 3, he couldn't care less about what happens to his patient. He can't even think about how to solve problems and sees the patient as an enemy and wants to drop out, wants to get away, wants to move away from everything that's going on. And guess what? They want to commit suicide. And this is really the saddest part of it all. And that is that physicians today have one of the highest suicide rates out of any sector in the country. Every day a doctor commits suicide. Every year we lose a medical school class worth of physicians, productive, engaged physicians in the prime of their career because they kill themselves. And it's attributable largely to burnout. And there are other effects on burnout, other effects on healthcare besides physician suicide, which you see in this list, but obviously decreased production, decreased quality, premature retirement, misguided policies. There have been interesting pieces of legislation that have been put together over the past decade to try to combat this problem of burnout, and a lot of it falls on the training of physicians. So now what we're starting to see is that this problem of burnout in seasoned physicians is now moving upstream, and we're seeing residents who are burning out and killing themselves, and even now medical students, and it's a real travesty. Fortunately, the industry is starting to pay attention and listen, but it may be too little too late. Ultimately, physician vulnerability to burnout shows us that medical practice, the way it is structured today, is fragile. So the question then is, well, what do we do about it? What is the antidote? The antidote is antifragility, of course, right? Well, what is antifragility? Well, if you come back to that notion that stressors lead to cracks, right? In a fragile system, brittle substances will succumb to those cracks. The glass that's been banged around will finally break. But in an antifragile system, the substances actually get stronger with stressors. These are the kinds of things that we like to hear. What doesn't kill you makes you stronger. And we go into this quite a bit of depth in our workshop lab. And this is a graph that comes from Nicholas Taleb, who's an economist and just a very fascinating researcher and academician. But he makes the case here that fragile systems succumb with very little amount of stress. Anti-fragile systems, as you can see with the upward pointing arrow, actually benefit from stressors because innovation is baked right in. So the antidote to being a fragile physician, to become an anti-fragile physician, well, how do you do that? There are two steps, and we go through this in our workshop. But number one, protect yourself from fragility, from the downside. And number two, embrace and capitalize on disruption when it comes your way. Don't let it swamp you. So how do you protect yourself from fragility? Number one, well, you got to get help. You got to get outside objective guidance from trusted advisors who actually understand physician disruption. And number two, how do you embrace and capitalize on disruption? Well, it's all around us. If you start to look for it and you embrace disruption and you capitalize on it, you can solve so many problems. If you think about how healthcare is fragile, medicine is, hospitals are, physicians, reputation is fragile, right? I've heard this new saying going around, which I really like, which is that you can't control your reputation, but you can control your own character. I love that. I can't control what other people say about me, but I sure can control what I do about my own thinking. Reputation is fragile, but if you look at it differently, how am I nurturing my character? Boom, anti-fragile. Revenue is fragile. Well, how do we change it? How do we alchemize that fragility and start to capitalize on it and actually become anti-fragile? Well, we go into that in our workshop quite a bit. And so in our workshop, you're going to basically learn, number one, how to recognize and reverse burnout. So if you're a physician and any of this is resonating with you, please get help now. Don't wait for me. But in our workshop, we will actually walk you through as a physician, what are some of the easy ways to start to reverse the trend of burnout? And if you're a trusted advisor, you're helping physicians, you really ought to be on the lookout for this. I would even go so far to say as you should be proactive to try to ask your clients some questions and test and see, because if you care about your physician, and after all, they're paying you for services, if you lose that client because he's killed himself, where are you then, right? So I think it really behooves trusted advisors to care about their clients. And I know you do, just like physicians care about their patients. And so this is a great opportunity for you to learn more about it. And then number two, how to turn fragility into opportunity by becoming anti-fragile. So we go through that in our lesson, in our second week of our workshop. In week 3, we're going to talk about lesson 3, which is financial threats and losses. So we're kind of building up to this here. And I'm going to shift things around a little bit. I'm going to give you 5 secrets that I've learned. Secret number 1 is that the medical licensing agency is there to protect the public, not physicians. So we talk about the Board of Medicine and the health department, and they're a necessary part of the bureaucratic infrastructure. But if a doctor feels like getting help, the medical licensing agency is not the place to go. So I want you to just keep that in mind. Okay, there are ways that You need to handle things if you're really suffering with burnout so that you come out on top. Secret number 2, physicians don't really have due process when it comes to hospital credentialing disputes. We are not normal citizens. Physicians do not have the same rights as the average person on the street, believe it or not. Well, guess why? Because we also have extraordinary privileges. We're very lucky people as a sector of this country. So physicians have all sorts of great things that are given to us, but at the same time, when things go bad, they go bad in a really bad way. And there are laws like the PSQIA and the HCQIA, which are supposed to govern how hospitals handle credentialing disputes. But at the end of the day, when you've got physicians and administrators who are targeting you, you have very little recourse unless you get help very early on in the process and you know exactly how to stop it. Otherwise, when it snowballs out of control, you're done. Secret number 3, medical malpractice companies can settle cases out from underneath a physician. So physicians have worked very hard to have laws passed all throughout the United States. And in October of 2011, the Florida Medical Association actually was victorious in having new laws passed in Florida that gave physicians the right of first refusal, the right to decide whether or not a case should be settled or go to court. Well, guess what? If you're employed by a hospital system, that may not hold water. When a hospital system negotiates contracts for you and you give that process away to the administrators, you better be careful. I didn't read any of those contracts, and you would be shocked to know how many physicians simply trust the system to take care of them. Time after time now, I talk to colleagues who come and tell me that they had no idea that a hospital could settle malpractice cases, that a malpractice insurance company, a professional liability company, could go ahead and settle cases that they wanted to take to court to be vindicated because they knew that it was wrong, they knew that they were right, and yet somebody made a financial decision that was good for the corporate entity. So secret number 3 is tuck that away. Secret number 4, plaintiff attorneys are pursuing big group settlements to make it worth their while. If one malpractice action takes years and hundreds of thousands of dollars or millions of dollars, well, isn't it better for the malpractice to be widespread, to be endemic? The extents to which firms will go to in order to justify what almost look like class action lawsuits is absolutely amazing. And you'll learn about the dirty little secrets that are getting played in our workshop. But it should send a chill through the spine of every physician if they're not aware. And trusted advisors, you're in an amazing position to help physicians to protect themselves in the first place from even having to face this. But if it gets rolling, you're their first line of defense. Secret number 5, physicians' adversaries will actually advertise on social media and use a physician's own social media content against them without them even knowing about it. So you have to be very thoughtful as a physician if you're going to be engaging in social media to have a plan to protect yourself so that if your content starts to show up in other places and you've lost control over it, you need to be able to react to it quickly. And this is one of the things that we'll teach you in our workshop. I'll give you a bonus secret here as well. Maybe it's not a surprise, but physicians' adversaries don't want resistance, and they'll use fear tactics to scare physicians into submission. So this is one of the reasons why physicians don't speak up, is that because largely they're afraid. And they know when they see one of their colleagues go down in flames because they were non-compliant with some initiative that a system was putting out, they circle their wagons pretty quickly and they get compliant, but they're working in fear. Well, courage is the antidote to this. Courage is the way to anti-fragility, and we talk about that quite a bit. The not so secret result of all of this is financial losses. So you can imagine in every one of those instances, financial loss emerges. And so it's really important, if you're a trusted advisor, to be wary that your physicians may become impoverished. You may lose them as clients if things go bad. So it really is important for you to understand these losses. And there are really 5 main sources of financial loss. Number 1 is professional regulatory actions. Number 2 is cyber technology problems. It actually turns out that more damage is being done today because of hacking and cyber attacks Physicians are experiencing more loss from those than from medical malpractice actions now. It's becoming a huge problem. Number 3, antitrust actions. You would think the mafia were involved somehow. Number 4, practice transition problems. So is your practice selling? Is it buying? Is it moving from a private setting, an independent setting, into a hospital? That's a major source of potential loss. And then number 5, life transition problems. Change in life is difficult. And there are many ways that physicians can be affected in just life outside of practicing medicine that may not even come across your table as a trusted advisor, but definitely affects their ability. So in our workshop lab, you're going to learn the details behind the 5 secrets and how to manage those 5 sources of financial loss. And this brings me to lesson number 4, which is getting qualified help. So let's take a breather here, because this sounds pretty heavy. This sounds so weighty. Now that you understand physician disruption, burnout, and financial loss, how are you feeling? Are you feeling overwhelmed, maybe unprepared, possibly afraid, and maybe even pessimistic after this litany of issues? Well, it's to be understandable if you are, but let's try to be optimistic instead, because there is opportunity in all of this. Let's look at how to get help in terms of solvable problems. So just to kind of recap here, problem number 1 is that physicians are losing control and power over their professional lives. Why? Well, physician disruption is causing many physicians to be devalued and disempowered. The result is that physician disruption is causing many physicians to burn out. What is the solution? Become anti-fragile, being made stronger by chaos, uncertainty, and disruption. Another set of solutions is to make transitions. Some doctors will retire, they need help. Other doctors will repurpose themselves and decide to take their knowledge and their wisdom and enter some other related industry and benefit from it, and benefit the industry as a result. And then there are doctors who, if they're going to stay in practice, really need to redesign the way they're doing things. With the way that big data is showing up on the scene and artificial intelligence, chatbots, telemedicine, there's so many technological advantages that are coming down the road that can help to improve efficiency for physicians, but it really does take quite a bit of work for that solution. How do you get these solutions? Well, you build strength through a formidable team of trusted advisors who protect you and help to turn adversity into strength. Sounds pretty simple. That brings us to problem number 2. It can be very difficult, as we've shown already, to assemble and coordinate a team of highly knowledgeable, qualified, trusted advisors. Why? Because many trusted advisors don't understand the elements of physician disruption. You who are here on this call today, you have an advantage now. Now you have knowledge of physician disruption. And I recommend that physicians tap into a network of trusted advisors who have the right kind of expertise and can provide comprehensive, high-level guidance. And that's what we're building here. So I'd like to suggest physicians and trusted advisors to join us, participate in our workshop lab, and join our network. This is something that we're just kicking off. It's fledgling. But let's get into some of the details. The workshop lab goes over a month. It's a 4-week experience, and you'll have 4 one-hour meetings over the web. Somewhat similar to what we're doing here now, but with interactivity, two-way calling, two-way video, and going into much more depth and more detail. The benefit is that you'll become better prepared to manage and then benefit from healthcare disruption and physician disruption. You'll get engaged with like-minded physicians. If you're a doctor, with your colleagues. If you're a trusted advisor, with physicians who you may be looking to serve. And likewise, if you're a trusted advisor, you'll have maybe some of your colleagues in the group who are part of your network. And they're all getting wise here. And so what we will cover over those 4 weeks are the top 4 challenges facing physicians that we've just gone through. And if you turn to your workbook, you'll see that you've got a page for each one of those top 4 challenges. Each one of those weeks is a module that we'll be using to help to guide you. You'll also be getting training on our personalized disruption risk score. And since those of you who have stuck through here so far, we're getting close to the end here, you're going to get a bonus. I'm going to give you a link that you can link to in order to download that disruption risk score. But I do want you to have training on it, right? So if you join our workshop lab, you'll get the more in-depth, incisive view of how you use this risk score, which if you're a trusted advisor, you can apply to your physician clients out of the gate. You can come up with assessments of all of your clients and determine who's at risk just from what you already know about them. it will prompt you to also go back to them and say, hey, look, I've just heard about this notion of physician disruption and all the things that can happen. How are you? Are you okay? Are you handling things all right? Let's talk. You also get free access to our network. And this is very important. Because you're participating in a workshop lab, I want to give you, and my partner and I want to give you free access to get involved. Now, this is for those of you who participate in this on-ramp. Anybody else coming in is going to end up paying for access to the network. We also want to give you the first 2 months of membership fees for free. So basically, you're going to be paying, you're going to get paid back for joining the workshop lab. So if you consider the impact that disruption has had on healthcare and considering the potential loss of practicing physicians because of mismanagement of disruption, wouldn't you agree that it's crucial for both physicians and trusted advisors to be better prepared? This is why we've created the Restored Physician Network for you. And this is what it looks like in concept. Physicians and trusted advisors coming together in one network where they'll all have access to crucial insights like what you've gotten today. And I really hope that I've provided you some value today and some insights into what physicians are going through right now. You'll also get higher level education, get in-depth training. You'll get access to videos and other documents that we post online that are behind our private membership site that only you can get access to. You'll have another area where you can develop relationships, but from a totally different perspective. This is not networking, showing up for happy hour at a bar somewhere and shooting down a couple of beers. This is intense relationship building that is meaningful. It's meaningful because you're helping people who are helping people. By shoring up physicians, you're taking care of hundreds or thousands or even millions of patients across this country who need help. And in our network, you're also going to get access to valuable resources that will help you to coach your other network. So if you're a trusted advisor and you've got a handful of other people underneath you, you'll be able to get access to resources that you can then use to train downstream. And likewise for physicians in terms of helping your colleagues. So obviously the question is, will it help me? I like to think that by now you'll see that obviously you'll be helped. And if you join now, you'll be remembered as a pioneer. You'll be remembered for helping to build a brighter future for physicians and their patients. This is critically needed. If you're a physician, you'll be on the on-ramp to creating an anti-fragile existence for yourself, and you will find yourself thriving in the middle of disruption. If you're a trusted advisor, you'll maybe reduce your liability for error, and you'll definitely tap into an enormous market of physicians who earnestly need your help. So if you sign up now for the workshop lab, the registration fee is $279. That's a one-time fee. And for that $279, again, you're going to get 4 one-hour web sessions, and then all of the material that comes out of those sessions will be given to you. You're going to get free training on the Disruption Risk Score tool. We're going to waive the network application fee, which is $579, and the first 2 months of membership will be free. That's $358 altogether. So basically, you're getting $1,000+ of free access for just $279. And so I'm going to just hang out here for the next 15 minutes so we can kind of talk about this, and I'm going to open up the field for questions. But I would like to point out that there are 2 links down here. Okay, on the left-hand side of your screen, you've got a link. All you need to do is point your browser to a bit.ly link here. It's TRP Workshop Join, and that will take you to a registration page where you can apply for membership in our workshop. All you need to do is put in your details, and I'll go ahead and contact you, and we'll get you signed up for it. And on the right-hand side of the screen is a link for your free bonus that I promised you. If you were brave enough to hang around and felt like you could endure all of the news about what's going on with physicians, well, here's your reward for it. And if you follow the TRP webinar completed link and enter your information, then we will mail you the personalized physician disruption risk scoring tool so that you can at least start to use it today, even before we train you. And I think it's pretty self-explanatory. You'll definitely be able to apply it over a larger group of patients and with a big data approach if you let us train you on it, but there's no reason why you couldn't get started. That's our free gift to you today. So I want to thank you, and I'm going to go ahead and open up the platform now for frequently asked questions, and I will come and take a look here. And so first question I'm getting here is, how long will it take me to get through your program? Well, okay, so just kind of as a recap, this is the workshop lab. Really, this is a 4-week experience, but each week, it's going to be an hour of your time, right? So somebody calculated this for me one day. 1 hour out of every day is 4% of your day, right? So 1 hour out of a week is less than 1% of your whole week, right? And it's like 0.5% of your week. It's nothing. 1 hour takes very little time to go through, but it's going to be jam-packed full of information for you. And after that hour-long session, like what we've just gone through here, where it's almost done, right? Lickety-split. You're going to have materials that come to you throughout the rest of the week that capture what we did in our workshop. We're going to be, I'm going to be asking you questions and want to get direction from you. You're going to be asking me questions. We're going to be building this as we go through it. So it really is going to be as much as you want to get out of it, you can put into it. But ultimately, it's a 4-week-long workshop. And then once you enter the network, then we're going to have many other activities that come out of that workshop that allow you to tie into physicians and physicians into trusted advisors. All right, question number 2, if I'm traveling, will I get behind? Well, really no. The benefit of this is that it's done virtually, so you can be anywhere. We will actually be recording the workshop lab episodes. So if you happen to be on an airplane and you can't get signal for whatever reason, although these days pretty much every airplane seems to have signal, but if you can't participate for whatever reason, you have a prior obligation, at least you'll be able to dial in later, listen to the recording like you might in so many other webinars, and you'll be able to at least get the value out of that episode. We will have opportunities as well throughout the week. We have a member page, a private member page on Facebook that we're developed. So you'll be able to interact with your peers there and get caught up and have dialogue. So we really want you to get a lot of value out of this, and I'll make myself available as well for Q&A throughout the week. So even if you're traveling, even if you have other obligations, you will not get behind on this. So really no worries there. All right, question number 3. What else do I need to buy to see results with your program? Well, you do need to have technology in order to get access, okay? So, but something tells me if you're here right now, you've got that technology. Really, there's nothing else to buy. What you're going to get is access to a members area. You're going to get access to library that is just for you. So as materials accumulate in there, you'll have access to that. Now, down the road, we may offer, and I'm sure we're going to offer other events. We look forward to having conferences, and specifically, we will likely be working with groups of trusted advisors. So if you're an accountant, you want to come to a lunch where we talk to accountants only, there may be a little charge associated with that, but ultimately, most of that's going to get wrapped into monthly membership fees, so I don't see that being a big issue. Do you have other, question number 4, do you have other levels available? Right now, we are simply making one level of membership available, and that's the general membership. Now, if there are specific consulting needs that need to get met, if there are specific burning issues, we actually do have other solutions for you. And I would encourage you to visit restoredphysicians.com, and I will make sure that we've got that mailed out to you. But you should have that in your email. It's restoredphysicians, plural, restoredphysicians.com. And my partners and I do offer consulting services. So if a physician is in the middle of crisis and needs a team to rally around him, we can do that. If there's a slow burning problem that a medical practice needs addressed, we have solutions that we can offer. We can draw from trusted advisors who are part of our network and bring them as part of a team to help out. So if you're in industry support, let's say you're with biotech or you're with the data science industry and you want really high level insights consulting, our team is available for that as well. So you'll find those on the restoredphysicians.com website. But as part of this program, those levels are not going to be available. These are good questions. All right, question number 5, do I get lifetime access? Yes, this will be available to you as long as there are computers and electricity is available and the internet still works. So the idea here is that once you have paid your membership and you're in good standing, you'll always be able to enjoy the availability to this material and to the network as well. So we encourage you to join, and we'd love to have your input. What What is the refund policy if I'm not satisfied? We guarantee your satisfaction 100%. So if you join the workshop and you find that it's not valuable, we are perfectly happy to refund all of your money, except we just expect that you are there and that you're participating. We want to know that you've been there and that you're contributing to the group and that you're actually engaged in the process. We won't refund your money if you don't show up, because how can you get an experience out of that? But as long as you're participating in the group, if you find that it's offensive in some fashion, or you know all this already, or it's just not of interest, and maybe it's not part of your field, and you accidentally signed up, and you in good faith have shown up, we'll give you your money back. That's fine. We don't want to hold on to money from people who are going to be dissatisfied for those reasons. So last question, I think, before we wrap it up here, and that is, do you offer a payment plan? Well, right now we don't. We think that the value that that you get out of this program is so huge. You're going to be saving $1,000 out of the gate, basically, just by enrolling in the workshop lab. So if there are specific instances where people are really struggling, but you really are devoted and you really want to invest in yourself, send me an email and we'll see if we can't work something out. But for the most part, I think most people who are interested in this and who are willing to invest themselves can scrape together the fee to get started. All right, well, I think those are the main questions I'm getting from my, my assistant here. I would just like to thank everybody tonight for participating in our inaugural workshop lab webinar. We are going to be airing this again tomorrow night, in case anybody is interested in coming back because you'd like to repeat the experience or something that you missed. If there's a technical glitch on your side you want to come back, please feel free to register. It's free. I would strongly request that if you enjoy this, that you spread this amongst your friends. We're going to take enrollment tomorrow all the way up till 7 p.m. So if somebody wants to come in at the last minute, as long as they've got email that'll turn around fast for them so they can get the link, then we're perfectly happy to have them join in on the fun. And but after tomorrow night, we're going to be done with this, and we're going to be launching on May 10th the actual workshop lab. So between now and the 10th, we've got more information that will be coming out your way. If you do decide that you want to join, then wonderful. We'll look forward to having you there. After you register, you're going to immediately start to get email from us that will indicate the details about where and when and how to get started and what kind of materials and pre-event reading will be helpful for you. We will have, just like we did for this particular webinar, we are going to have workbooks that will be made available to you ahead of time so that you're prepared, and they build off of what we've already given you here today for free and go into more depth. There will be actionable items that you're going to leave every week with immediately so that you can start to put them into practice. If you're a trusted advisor and if you're a physician, you're going to be able to put them into use right away as well in helping yourself to achieve more success. So with that, we'll go ahead, and I just want to tell everybody thank you again. This is Dr. Sean Orr with the Restored Physician, and on behalf of my co-creator, I want to wish you all well, and thank you very much for joining us tonight, and have a great evening. Bye-bye.